I knew that I always wanted to be a doctor even when I was a kid. I carried around my little fake Fisher-Price stethoscope and doctor's bag. So I always had this huge dream of becoming a physician. I came from a middle-class family who emigrated here from the Middle East, and we didn't have the financial abilities to put me through college and graduate school on top of that.
Medical student debt continues to increase at an alarming rate. Many young physicians today grapple with unmanageable debt to the tune of $170,000 on average.
During my third year of medical school, I decided to take a year off to obtain a degree, a Master's of Business Administration degree with a concentration of health sector policy and management. And had it not been for the scholarships I received during that one-year program, I would not have been able to take that year off.
I am a proud alumni of the University of Miami. I was a recipient of scholarships both when I did my undergraduate work as well as in medical school. And that made a big impact actually on my life because my parents would otherwise not have been able to afford a private school like the University of Miami.
Medical school graduates who are saddled with tremendous debt are less likely to choose pediatrics, family medicine, general surgery, or internal medicine. These lower-paying specialties are the backbone of our healthcare system nationwide.
There is already a tremendous shortage of primary care physicians.
With additional scholarship money, we hope to be able to attract students to more primary care fields such as pediatrics, internal medicine, and family medicine, which is going to be vitally important as healthcare continues to evolve.
One thing that really drove me to attend the University of Miami was the DOCS program and our student-run health fairs.
The DOCS program is a significant asset to multiple communities in South Florida. Our students go out and screen hundreds upon hundreds of patients that don't have access to health care.
And it's that kind of program that really elicited patient care and cultural awareness that made me want to pursue OBGYN as my specialty.
After medical school, our students enter residency programs anywhere from 3 to 8 years, and given the average debt of $170,000, they don't have a sizable salary to be able to start paying those loans back.
Average medical resident salary is $45,000 and will remain in that range for the 3 to 8 years of residency and fellowship training.
At the Miller School of Medicine, we know that scholarships are critical if we are to continue to enroll the best and the brightest future physicians. I'm pleased to say that donors are stepping forward. These dedicated individuals include members of the university's Board of Trustees, medical school parents, and alumni who are establishing endowed scholarship funds in honor of their graduating classes.
I definitely think that if it were not for the scholarships that I received, I would not have been able to focus on my education as much as I have been able to do so.
If it wasn't for scholarships, I don't think I would have the ability to be calling myself a physician in a couple months.